Welcome! Today, we're going to address something many of us experience, a prominent, ready-to-be-cleared whitehead. Are you ready to see how to manage this safely and effectively, ensuring the skin heals beautifully afterward? This is a purely educational guide, intended to demonstrate a gentle, hygienic approach. It is not medical advice. If you ever feel uncertain, or if your skin concern is painful, inflamed, or deep, please consult a dermatologist. Your safety is always the first priority. Let's begin. Our journey starts with impeccable hygiene. This is the most critical step and it cannot be rushed. First, wash your hands thoroughly with soap and warm water for at least 20 seconds. Pay close attention to the areas under your fingernails and between your fingers, where bacteria can hide. Dry your hands completely with a clean, fresh towel. Now, to create a sterile barrier between your hands and your skin, we'll put on a pair of nitrile gloves. This prevents the transfer of any oils or bacteria, which could otherwise lead to further inflammation or infection. Next, prepare your workspace. If you plan to use any tools, like a comedone extractor, they must be sanitized. Submerge them or wipe them down thoroughly with 70% isopropyl alcohol and let them air dry completely on a clean surface. We won't be using a metal tool today, opting for a gentler method, but this step is crucial for any instrument. Have your aftercare supplies ready and within reach. Sterile saline solution for cleansing the pore, soft cotton pads, and your hydrocolloid patches. Being prepared prevents fumbling and maintains a clean environment. Now, we prepare the skin itself. A double cleanse is ideal. Start with a cleansing oil on dry skin. Gently massage it over the area for about 45 to 60 seconds. This dissolves surface-level sebum, sunscreen, and debris without stripping the skin. Add a little water to emulsify the oil into a milky liquid, then rinse. Follow this with a gentle, pH-balanced, water-based gel cleanser. Massage this for another 45 to 60 seconds to ensure the skin is perfectly clean. When you're done, don't rub. Gently pat the skin dry with a soft, clean towel. To make the extraction process smoother and less traumatic for the skin, we need to soften the pore. You can do this by applying a warm, damp compress, like a clean washcloth soaked in warm water, to the area for 2 to 3 minutes. Alternatively, a facial steamer works wonderfully. The warmth and moisture help to relax the pore opening and soften the keratin plug, making the contents easier to release. Before we proceed, we must assess. This is the most important decision you'll make. A whitehead is ready for extraction, what we call a green light, only when it has a distinct, visible white tip at the surface. The center should look soft and pliable. This indicates the contents are near the surface and ready to be expressed. What you must not touch are lesions that are deep, hard, red, and painful, with no visible head. These are likely nodules or cysts. Attempting to extract these will only cause trauma, spread bacteria deeper, and lead to significant scarring and post-inflammatory hyperpigmentation. Leave those for a professional. Today, our whitehead has a clear green light. We will use 2 cotton swabs for a gentle, controlled extraction. This is much safer than using your fingers, which can apply uneven pressure and damage surrounding tissue. Place the tips of the swabs on opposite sides of the whitehead, positioning them at about a 45-degree angle. Imagine you are creating a small, supportive frame around the lesion. The goal is not to squeeze, but to gently stretch the skin and encourage the contents out. Apply slow, steady pressure downwards into the skin, and then slightly inward, toward the base of the whitehead. Think of it as pressing down and then rolling up and out. Be patient. The contents should release with this gentle pressure. You are looking for a single, clean expression of the core. Once the sebum plug is out, you must stop. If you see any clear fluid, which is lymph or a pinpoint of blood, that is your absolute signal to cease all pressure. Over-extracting is a common mistake that leads to scabbing, scarring, and a longer healing time. One and done. And what if nothing comes out? If the whitehead resists your first gentle attempt, you can reposition the swab slightly and try once more. If it still doesn't release after a second gentle try, you must stop. This is non-negotiable. The whitehead is simply not ready. Forcing it will only cause micro-tears in the skin, leading to inflammation and potential dark marks that can last for weeks or months. It's far better to leave it, apply a spot treatment, and wait another day or 2. Immediately after a successful extraction, we move to aftercare. First, gently blot the area with a cotton pad soaked in sterile saline. This cleanses the pore of any remaining bacteria without being harsh or irritating. Do not scrape or rub, just a gentle press and lift. Pat the area completely dry with a new clean pad. Now, we apply a targeted treatment to disinfect the pore. A microdab of a 2.5% benzoyl peroxide gel or a 2% salicylic acid treatment is perfect. Use the tiniest amount, just enough to cover the opening. This helps to kill any lingering acne bacteria and prevent the spot from refilling. The area will likely be a little red and inflamed from the process, which is normal. To calm this down quickly, we can use cold therapy. Gently glide an ice roller or a cloth-wrapped ice cube over the spot for about 30 to 45 seconds. The cold constricts blood vessels, which immediately reduces redness and swelling, providing soothing relief. The final and most crucial step for healing is to apply a hydrocolloid patch. These little patches are miracle workers. They are made of a moisture-absorbing material that creates a moist, protected environment, which is optimal for wound healing. It will gently draw out any remaining fluid from the pore, protect it from outside bacteria, and, just as importantly, prevent you from touching or picking at it. Press it on gently to ensure the edges are sealed. Leave it on for at least 6 to 12 hours. Overnight is best, as your skin does its most intensive repair work while you sleep. When you remove it, the spot should be significantly flatter and less red. For the next 24 to 48 hours, treat the area with care. Do not use any harsh physical scrubs, strong chemical exfoliants like high-concentration AHAs or BHAs, or visit saunas or steam rooms, as excessive heat can increase inflammation. If you need to apply makeup, opt for a mineral-based powder applied with a clean brush, as it's less likely to clog the healing pore. And above all, keep your hands off. The hydrocolloid patch is your best friend here. If you feel the urge to touch the spot, that's your cue to make sure it's patched. This simple rule will dramatically improve your healing outcome. Let's recap the essentials for a safe extraction. A clean environment, a properly prepared and assessed whitehead, a gentle technique using swabs, stopping at the first sign of fluid, and a thorough aftercare routine involving saline, a spot treatment, and a hydrocolloid patch. By following these steps, you can manage occasional whiteheads without causing damage, helping your skin to heal quickly and cleanly. Thank you for joining me in this calm and careful process.